Let's welcome Allan Geller, a senior lecturer on social and behavioral sciences at Harvard T.H. Chan School of Public Health, who'll help us understand what these numbers mean and how they're applicable to our daily lives. Welcome, Allan.
Thank you very much for the great introduction, and I'm delighted to be with everyone today. I think we can probably go to the first slide. So I'll have 4 brief points to make this evening. The first one, the most basic, is that COVID-19 is very common among children ages 0 to 19 in the United States and Massachusetts. And in fact, there are more cases diagnosed in children right now in the United States and in Massachusetts than for any other age group. Second, we need to get a really good reporting system in place so we know what the extent of the pandemic is and how it affects children. Therefore, we need to look at the discrepancy that we see now between the numbers we get from DESE and the numbers that we get from the Department of Public Health. 3, we continue to have far too many high-risk communities in our state, and we have to ask the question, if schools do reopen or in the process of reopening, how can we make them as safe as possible for staff and students, particularly in those high-risk areas, which have been in remote settings for many, many months now. So, there used to be the old saw we all remember hearing not so many months ago, children really can't get COVID. And so I said, is that really true? So if we look at data published from the American Academy of Pediatrics, a very trustworthy group, and they rely on data from departments of public health all across the country, they tell us as of January 28th that there were nearly 2.82 million children have tested positive for COVID since the onset of the pandemic. Now that's of course across the whole United States, and we know that kids are more likely to be asymptomatic than adults. So we have to think that these numbers are well higher than 2.83 million children. There's an undercount. Not only are these numbers from the past, but we can see if we look at the second bullet that there's been a 12% increase in child COVID cases, COVID-19 cases, over this last 2-week period of time. So the rates continue to rise and rise precipitously among children. Next slide, please. Now, let's take a look at these next 2 slides. Here's the first one. This is for the first 5 months of the pandemic, March to July 2020 in Massachusetts. And you'll see there, while we were all in lockdown, and not to our great surprise, that there were fewer than 6,000 diagnoses among children during that period of time. And in fact, many other age groups, older people, middle-aged people, were far more likely to be diagnosed with COVID. But when we switch to the most recent period of time, with the next slide, thank you, we see here now over the last 2 weeks, the group that stands out, the largest bar, are children 0 to 19 years of age, where over the last 2 weeks, we've seen nearly 11,500 cases. And you can see that they represent about 20% of all cases diagnosed in the state. So keep that number in mind. And I guess you don't really have to do that because you'll see here on the second column, you'll see that same number again. And what this slide is trying to do for you is to show the number of cases as it's increased across the state as we go from November 4th to January 27th. And you can see here that it's increased about 4-fold. But what I'd like to draw to your attention are the number of cases that DPH reports during this period and the number of DESE cases that are reported during this period of time. Now remember, DESE is only reporting on children who go to school, whether they're in a hybrid or a full-time setting. And we're not including daycare children, we're not including kids in private schools. But it's strange credulity if we would ever imagine that there's only 624 COVID diagnoses in all of our children attending public school. If you do the math and you think about 250 districts that are open, that would mean only 2 cases every week per district. So any way that we're going to try and control this pandemic and get a good sense of how serious it is, we've got to have real numbers. And the last slide, I'm going to make a push for you all to send me your dashboards, which I know are spectacular, where we'll get very different cases. So if we look at the cities where all of you teach in, there's many that have been well in excess of 80 or 90 cases per 100,000. But these 9 cities in order, and you can see they stretch every single part of the state, have the highest COVID rates. And this means an incidence of 100 cases per 100,000, which very simply means that if you lived in a city with 100,000 people, every day in your city, there would be 100 new cases of COVID being diagnosed, and you can then just estimate that 20% of them would be in children. So let me just go to the next slide just to see if we can put this in perspective. So here's one city, and again, these are all phenomenal public health leaders leading the charge in every single one of these cities. But let's just take a peek at Gardner, where you saw just in the slide before, that has the highest rate of COVID in Massachusetts now. And just look at the numbers and try and imagine this to be real people. We see here on November 12th in Gardner, in the 2 weeks preceding that, there were 63 COVID diagnoses. And you can see the numbers as they go up to now January 21st. Just a few months, actually 2 months, that has risen to 389 cases every 2 weeks in a city of 20,000 people. So imagine sort of the difficulty in thinking about going back to school safely, but this is what we want to try and think about and how we can best do that. So a couple of basic tenets. Let's think about it first from a community's perspective. So, there was an article that came out from the CDC that got misrepresented in the media to say that the CDC was recommending that everybody goes back to school. But no, they weren't saying that. The first point that they were making is that the community rate has to drop. We've got to be able to think of all steps necessary to reduce community spread before we send kids and teachers back to school. And I think, and a number of other people think, that we have to at least prove before we go back that the community rate has to begin to drop, and we have to see some consistency in that drop. We can't send kids back to the Gardners and the Lawrences and the Chelseas and the Great Barringtons of the world until we begin to see some kind of drop. And I think this is a realistic thing to call for. So that's the perspective from the community. And I think as the last slide that I'll show is in some ways recapping what Mary was talking about, but here's from the school perspective, the basic tenets for a healthy return to school for students and educators. And I'm thinking about it again for these high-risk cities. So we have to ensure more than a sufficient supply of masks, soap, and hot water. I think one of the things that would be of great assistance is for the state to call together people who have had successful programs in their schools where they've done an excellent job reducing transmission, to be able to have some advice and to be able to talk with folks who are opening up now. Second, we can't go from soup to nuts. We can't go from a situation where a school has been fully remote to full-time in person with a full giant classroom. We have to return via a hybrid model where we respect social distancing. The other idea is to bring in a few grades at a time. Let's see how it goes if we bring in the K through 2s. Evaluate it. See how many cases arise, hopefully very few. And we should be having district-wide health advisory boards in all of these cities. These have done wonders in the cities where they've tried it. Mary talked, and obviously this is going to be the thrust of the conversation tonight. There should be testing of all returning teachers, staff, and students. Remember, my main point is if we have high rates of infection in the community among children, we can't have a situation where every single kid comes back into our schools without some kind of prior testing program. Finally, ensuring maximal ventilation and filtration. And the last part, we're saying as part of a package to try and reduce transmission and to make schools safe, particularly in these high-risk areas, we should at least be aiming for 2 vaccinations or both vaccinations for all teachers and staff. We're not saying that this should be something that has to happen, but I think it should be part of the conversation that we have when we think about these other larger mitigation strategies. So, thank you very much.
Wow, that was great.
And sorry, the last slide, please. I'm begging you. Here's my email address. I think we can really do a very nice democratic process led by all of you. Send me your COVID-19 dashboards. I have seen the ones in Belmont and Needham and Taunton, which are just phenomenal, where we get really good, accurate daily counts. And if we can get a handle on those, we can do a much better job on our own, trying to give a very good sense of what the real numbers are in the school.
Yes.
Thank you again.
Yeah.